I'm Edie Lush, and I'm here inside the Hub Culture studio. It's Davos 2020. Really pleased that Dr. Bronwyn King has joined me now. She's the CEO of Tobacco-Free Portfolios. Now, this is something that we would hope does what says on the tin, tobacco-free portfolio. But tell me the story of how you got involved in this issue.
Well, it's a great question, actually. I'm a cancer doctor from Melbourne, Australia, and throughout my early medical years, I saw firsthand, really from the front line, what tobacco did to people. I worked on the lung cancer ward at a huge cancer hospital, and for 3 months, nearly every single one of my patients died. And everybody knows tobacco's bad, but when you really see it firsthand, it leaves a really bad impression. 10 years later, I was buying a house with my husband and we were organising our finances, and for the first time ever I thought about my pension plan. And I sat down and had a meeting with the representative from the pension plan, and completely by accident I found out that my pension was being invested in big tobacco.
And that was the pension plan of the hospital.
That's right.
I mean, that's extraordinary, right?
It was 2010. In fact, I wish it was extraordinary, but in fact, still today, 90% of pension plans all across the world routinely invest money in tobacco companies.
Is that because they're part of an index and the tobacco company is part of the index?
Yeah, often it's because of an index, but often there's a little bit of active investment as well. And it's simply because the finance sector and the health sector have not been talking enough about tobacco, because in the health sector we know exactly what's going on. The world is on track for 1 billion tobacco deaths this century. It's a huge number. I mean, you really have to think about that. There's only 7 billion of us. 1 billion will die because of one product. And so in health, we know what's going on. The finance sector really operates just with the status quo, and that is that they invest in just a little bit of every company that exists. If you're a bank, almost certainly you will lend money to tobacco companies. Your pension plan, it will invest in tobacco companies, and insurance agencies provide them insurance. That's just how it is. But with a very small group of committed colleagues, I set up tobacco-free portfolios, and we work with the finance sector to really try to bridge that gap between the health sector and finance on the issue of tobacco. So we ask the CEOs of big banks to reconsider lending money to tobacco companies. We ask pension plans to stop investing in tobacco companies, and we ask insurers to stop insuring them.
Do you think that the same thing that we're seeing with regards to climate risk, we saw the report out by Mark Carney warning banks about investments in climate risk could be a long-term bad idea for their portfolio. Do you see a similar mentality accruing within this idea of tobacco-free pensions?
Absolutely. It's definitely become more than just a boutique issue. It's moved well beyond the discussion of morals or ethics. It's actually just a business risk. So the tobacco industry really faces some really unprecedented risks at the moment in terms of regulatory risk. There's 181 countries that have signed the only global health treaty that exists, the UN Tobacco Control Treaty, and that means they've committed to implementing more and more regulation all at the same time. There's litigation risk. The business model of tobacco companies is being called out. There's supply chain risk. There are 16 countries that use child labour to produce tobacco. And then the big one is there's environmental risk. So everybody's here at Davos talking about ocean plastic. The number one ocean plastic is in fact cigarette filters. So if you care about the environment, if you care about human rights, child labour, but if you care just about pure finance, pure business risk, it's time to take a look at tobacco.
All right, Dr. King, thank you very much for stopping by the Hub Culture studio here in Davos, and I'm Edie Lush.